Hello, we are Regina and Fernanda with the Education Program.
Today we will talk about how to prevent, protect, and treat malaria and pneumonia. Malaria is a disease that is caused by a parasite transmitted from person to person by a certain type of mosquito.
And pneumonia is an infection in the lungs, simply by any bacteria, virus, or fungi, which gets into the lungs by being inhaled or through the bloodstream.
Now we're going to explain the symptoms of each disease. The symptoms of malaria usually appear from 10 to 15 days after a mosquito bite. The symptoms are fever, chills, sweats, headaches, nausea and vomiting, and body aches. It can also cause anemia, which is the yellow color of eyes and skin due to the losing of red blood cells.
Now, most people who develop pneumonia have symptoms of a cold, for example, sneezing, sore throat, and coughing, and it follows a high fever, sometimes as high as 40 Celsius. When the infection settles in the air passages, cough and sputum are more likely to develop. It also develops a shortness in breath. Also, the person who has pneumonia may have a change in skin color. This condition is known as cyanise. It is a kind of bluish color due to their blood being poorly oxygenated. Barbara, tell us your experience about having pneumonia.
Well, I'm 17 years old and today I was diagnosed with pneumonia. It started off as a staph throat. However, the staph became resistant to the antibiotics I was taking and I started to get very ill. I had a very persistent fever in the 102 and 104 range. Luckily, my dad is a physician and immediately recognized the symptoms and took me to the hospital. I am now being treated and hope to have a smooth recovery.
And what do you do if you have pneumonia? First of all, you have to see your doctor or go to a local emergency room if your doctor is unavailable. If you have a high fever accompanied by cough that brings up colored sputum, or if you had difficulty breathing, receive anti-pneumonia medication, either oral or intravenous. Drink plenty of fluids. This aids the immune system and helps loosen lung congestion. Take analysis of pain. Your chest muscles may become sore from coughing and the added effort of breathing, and your body will feel achy from fighting infection. Then ask your doctor what analgesic is right for you. For severe pneumonia, your doctor may prescribe codeine, but it takes as sparingly as possible. Codeine suppresses coughing, and coughing is beneficial to the lungs. Rest if you have pneumonia. Get at least 8 hours of sleep each night, and take a midday nap. Cough and breathe deeply. Expand your lungs and help them heal by taking breath through your mouth, holding the air for 5 to 10 seconds and inhaling.
How to prevent malaria. Find out if you're traveling to places where malaria is a risk area. If you're visiting that places, go to your doctor 6 weeks before you travel and get prescription for malaria pills / anti-malaria drugs. Avoid wearing strong aftershave or perfume that smell will attract the mosquitoes. Wear protective clothing, use properly insect repellent, sleep under mosquito beds, switch lights while you are sleeping, and fixing your house / room to be mosquito unfriendly. Now I'm going to tell you the facts about malaria. 90% of all malaria deaths occur in sub-Saharan Africa. It is estimated that every 45 seconds a child is dead from malaria in Africa. One of the big problems in Africa is that they have a lack of health education, which leads to lack of malaria diagnosis and treatment. Annually, malaria costs an estimate of 12 billion in lost productivity in Africa, and the incubation period is from 7 to 30 days.
Now you know how to treat and prevent malaria and pneumonia.
Try to help people in your community with these diseases.
So see you next time in the Education Program.